Okay, if everybody's ready, we'll go ahead and get started. So as you all know, we called you here today because we received 2 positive test results yesterday for COVID-19 in Missoula County residents. So we just wanted to let you know that we do have those positive results. Our team is actively working on determining who the contacts are to those folks. We've had very good cooperation from the public who are involved, who have been close contacts. Those people that tested positive will be isolated until they receive 2 negative test results. And the contacts will be isolated and quarantined in their homes for 14 days and monitored for symptoms. And while we do recognize that this can cause a bit of alarm once we know that we have it in our county, we do want the public to understand that we are working very closely with anyone who may have been exposed. And we're getting great cooperation, so we're hoping that this will continue to slow the spread in our county. And that's my statement.
Can you identify the speakers, please?
Oh, yes, this is Cindy Farr. I am the Director of the Health Promotion Division, and I am the Incident Commander for our COVID-19 response in Missoula County.
Cindy, what is the process of tracking these 2 individuals? What are you doing right now?
So right now we've got nurses that are checking in with these 2 individuals. They have been instructed to remain in their home and that they are to take their temperatures twice a day. And they're, monitoring their own health so that if their symptoms get worse, then they are going to contact our nurses and we are going to help facilitate getting them taken care of by a healthcare provider. They are both recovering in their home right now. They are not sick enough to need to be in the hospital or anything like that. So we are working very closely with them so that if they do get to a point where they need inpatient hospital care or even to just be seen by a clinician, then we will help facilitate that in a safe way.
I was just asking about how you're tracking the people they've come in contact with.
Yeah, so we are working with the two patients to determine when their symptom onset began and then determining who they may have been in contact with during the time that they were contagious and then reaching out to those people and letting them know that they may have been exposed to a positive case of the COVID-19 and that they need to remain isolated in their home for the next 14 days. And they are also being told to take their temperatures twice a day, monitor themselves for cough, monitor themselves for shortness of breath. Our nurses are checking in with them twice a day. And in the event that they develop symptoms over the next 14 days, we will be helping to facilitate getting them in with a healthcare provider to get them tested.
How many contacts have you identified so far?
I don't have that number right now because my nurses are actively working on that right now.
Were they able to figure out where they got their exposure? Had they recently traveled?
We know that both of them had recently traveled outside of the Missoula area, but we're still nailing down where they may have been exposed.
Commissioner Christian has identified as presumptive positive. He was diagnosed in Missoula. The test came in Missoula. Is that correct? And is he one of the 2 that so far?
We don't disclose any information about our patients in order to protect the privacy of the patients involved. If they choose to self-disclose, then they are more than welcome to do that, but we don't comment on that.
President Bodner said he was with him at a recent meeting, and he was circulating, especially like last Friday's presser. Is that a concern at all?
We actually do not comment on any of the patient information just because we want to protect the privacy of the patient and the other people that are involved.
Statistically speaking, 2 people are presumptively positive in Missoula County right now. What did the statistics suggest? Is it limited to those 2 people, or is it likely it goes to 4, then to 8, and to 16, and on and on?
So currently we're looking at that it could be limited to those 2 people as we determine how many close contacts that they have been in contact with from the time that they became contagious. Then it is possible that the people that they were in contact with could potentially develop the disease. This is not considered community spread at this point because we know that both cases were a result of traveling outside of our community. So we are very early in this pandemic, so we're not really sure at this point what that's going to look like moving forward. But we are working very, very hard with those close contacts to make sure that they remain isolated so that if they do develop the disease, then they are not going to spread it to other people.
That's it. Cindy, do you happen to know if any of these individuals had visited stores or shopping malls or whatever? Is that something you've had a chance to look into yet?
Our nurses are working very closely with the patients to try and determine that.
Has the health department had a change in its approach since Friday? You guys planning anything that you didn't announce on Friday, or any changes to your approach to this outbreak? Or?
No, our approach is going to be the same. We've got the same protocols in place. At this point, we are trying to get more nurses. So we need registered nurses to apply to help work on this incident through our Human Resources Department. We've had that posted for about 2 weeks and have gotten very minimal response. So if we have nurses out there that would like to work, definitely contact our human resources at Missoula County because we do expect that this is going to generate quite a workload, and so we're trying to get extra staff in to help with that. We also did staff the call center yesterday to help answer some questions, and we may look at increasing the hours that the call center is available to help answer questions. But our initial approach is still what we're doing. It just may get larger.
How many nurses do you need, and how many have responded so far?
We need
As
many as we can get to apply. We have had very minimal response at this point.
Why, do you think, if you had to guess?
Because at this point in time, we know that our healthcare system is going to be very taxed with this particular pandemic happening. And so a lot of our nurses are already working within our healthcare system. So we are reaching out to see if there are any retired nurses that might be interested, or nurses that maybe have recently graduated from nursing school and just got their license that might be interested. But we know that most of the nurses in Missoula County are already working for our major healthcare system, and that's probably why we haven't gotten a whole lot of response.
What kind of pay could they expect?
Do you remember?
Yeah, I just want to comment a little bit on the nurses.
Do you want, yeah, that'd be cool. Thank you.
No, we're not going to do that. We're going to do this. Follow our process.
Oh, okay.
Thank you.
I don't hug Cindy at the end of a good day, a hard day. We are working over the weekend to look at any other nurses in our usual programs that we operate that we may be able to remove from those programs and deploy. There are some essential services and contracted services from which we cannot do that, but we're trying to get every nurse that hasn't already been assigned to the incident. I do want to go back just to give you some background on what we call contact tracing, what Cindy was describing in terms of following up with a known case of any communicable disease. That is a very ancient, consistent, and well-proven approach to stopping the spread of disease where you can, and that's called contact tracing. And so that's why we've been staffing up, waiting for the first case, and those are the same nurses and the same crew that have been doing the voluntary quarantine from travelers from early on, like from China. So we know we need to ramp up that crew, but that this is not a new way of operating. You might recall Pertussis in Missoula. That was contact tracing. That's what we do. That's what public health nurses and infectious disease nurses do. So that approach isn't new. We just expect that we need to expand. And that goes back to the question of, if we have 2, are we going to have 4? Are we going to have 6? There's no indication from anywhere else in the world or in the country, nor would I expect there to be one with a pandemic, a new virus, that would indicate that contact tracing alone is going to stop the spread of the disease. We are all theoretically susceptible. We will have more cases. So, and it will get more alarming. We're as prepared as we can be for that. But it's not all or nothing. We do the contact tracing, and that really gets us to the people who are the highest priority, because we know they were exposed to a case.
So yesterday, Logjam Presents postponed all the shows for 30 days. aquatics, the city's aquatic center announced that it's going to be closing down for at least through April. Why isn't the health department getting out ahead, saying, we're going to take proactive measures instead of being reactive in some terms?
We think we believe that our requests, as you've seen people self-close, that our information to date that we've been working on for weeks that you've helped us get out, we want to see the voluntary closures. We need to focus on what we just described. We also have a branch that helps people with how to implement those things. You've seen changes in patterns in the library.
You're being asked to speak up.
We're seeing all of those types of things. So that is proactive. The difference that I think is in your question is it voluntary versus mandated? If you can get 80%, I'm just throwing that number out, to voluntarily do that, and we're not having to respond to every single one out there, thank you very much. Thank you very much. Because we're going to use orders and different guidance as this progresses. But if we're getting a great response from voluntary and initiative, we are watching that, and we'll see who and in what arenas we may need to do more.
How many nurses? How many nurses does the health department currently have assigned to this situation?
That's changing as we speak.
Okay, and a follow-up question: how many ICU beds and ventilators are currently available in the county?
I don't know the number of ICU beds. I do know the number of, perhaps maybe more important, generally the number of respiratory isolation rooms, and there's probably over a dozen of those between our two hospitals.
Are there plans to scale up or create more facilities for patients at this point?
That you would have to speak with the hospitals directly. I know that just what they're doing with their screening activity is already really taxing them. Not screening, excuse me. Their testing activity in their primary care settings is already taxing, and we had a meeting with them on Friday about how we can marry any parts of this incident to that, and how we can all jointly perhaps staff that to give more testing capacity. It's a good time to state that people that think they may have been exposed because they know this person, or now think it's time to call for a test, is not helpful to the response. It is not helpful to call 911 and say, wow, I heard you had it in Missoula, I want to get a test. The test is not useful for that, and that further taxes the system. Please call 258-INFO. If you have symptoms, contact your healthcare provider.
What are the,
Can you repeat that number, please?
It is 258-INFO, which is 258-4636.
what would qualify someone to have one
Thank
of
you.
these tests done? Is there something that they need to be showing, symptoms, places they need to have been?
At this point, there is no evidence that someone who is asymptomatic or not showing any symptoms would have an accurate test result. So we are still, obviously, the data is still being collected on that kind of information. But what we do know right now is that if someone is showing symptoms, then they do get a very accurate test result. So the symptoms that we are most concerned about are shortness of breath, cough, and a fever over 100.4.
Now, I do realize this is the health department, but there's a lot of panic out there right now in Missoula. We've seen it in China, here in America, and now it's come to Missoula, Montana. And a lot of folks raided the grocery stores. People are stealing toilet paper. I mean, there's a lot of crazy stories out there. And I know it's not your job to maintain to restore a sense of calm, but what can you say to the folks out there who are listening to all of us who are recording this?
We have been preparing for a pandemic like this for decades. This is what we do in public health. It's what we have been prepared to do in public health. We've got our emergency plans. We've got our emergency planning partners that are working with us on this. So this isn't something that has taken us off guard. We've been actively working on planning for this pandemic since we first heard about it back at the beginning of January. And so I know that does not help people who are worried about the food supply or worried about running out of toilet paper, but we do want people to understand that, you know, we do plan for these things in public health. We are always training for this. We do exercises and tabletop exercises with our community partners, so that whenever something like this actually happens, we all already know each other. We all already know how to work together. And so we are now just putting all of those planning efforts into action.
Has there been any
Observation.
curveballs in this?
You haven't had a
I was
question.
just going to ask real quick, just observationally, how are we doing so far? I mean, you can look out there and sort of see what the traffic was yesterday, those kind of things. How are we doing on
Actually,
this?
we've been in the basement for
Yeah.
6 weeks.
So what's your general observation about how are we doing, especially since Friday's press conference?
So I believe that we are doing very well in Missoula. We are very well poised to react to this from a public health and emergency operations standpoint. We're not a small frontier community, and so we do have more resources available to us than some other communities do, and we have been actively working with our partners to make sure that we're trying to meet the needs for information, and that comes from all sides: information for the public, information for our providers, information from our stakeholders and community partners. So I believe that we are doing very well in our response at this point. We do know that things can change in a matter of minutes. And so we are ready to respond to those kind of changes that need to happen.
Have there been any curveballs so far that you?
Can I ask a question about the preparedness and the exercises that you just referenced earlier?
Yep, hold on one second, because I have another question that you probably couldn't hear.
Any curveballs
Okay.
that you all have not foreseen?
No, I don't believe so. I mean,
Not curveballs. This is what pandemics do.
we've had a lack of information because we're so early in the pandemic. The research that we need to make very good, accurate decisions is coming a little more slowly than what we've seen in other outbreaks. So many of you probably remember our very large pertussis outbreak last spring. Pertussis has been around for a very, very long time. There's lots of research on what you should do for mitigation and containment strategies, and as well as like laboratory information. If you have someone who's asymptomatic, is that test going to be accurate? We don't have that kind of information that we need at this point, and so we're having to base our response on the guidance that's available and our own knowledge of how we've responded to other pandemics and outbreaks in the past.
And I'm not trying to monopolize, I promise, but when positives do come out, are they coming, where are they coming from? The governor's office, or is DPHHS saying, Cindy, Ellen, here's what's going on? Is this getting politicized somehow or not?
Do you want me to take that, or do you want to?
I don't have the sense that it's politicized. Other people can form their opinions on that, and that's sure not something we're thinking about. The sense that I have, that we've been told, is that the governor, because he has created a task force and he has an emergency declaration, and we all wish, just in the same way that we said to you weeks ago, when we get a positive, we're going to tell you. It's not going to be a secret. Everything about that person is going to be a secret unless they decide to talk, but we're going to tell you. And so we're seeing this different way of communicating from the state to the local health department as these first positives arrive. And it is, they're going out quickly, the news, and it is causing a bit of a public information scramble. But it is we're getting quick responses. I don't expect, just like we're not going to be announcing press conferences for our next cases. They're going to do what we always do. We have it on our website. Our case count's going to go from 0 to 2, and the next time it goes up, it's going to go, and that's where you can look. But this initial time, I think there's a sense of let's let the public know.
Okay, so it's coming from the governor's office, or it's coming from DPHHS?
It's coming both. We get it from DPHHS immediately, so Cindy had it immediately when the test results were read, and then we were informed that the governor's office was going to release publicly, but we did have it first.
President Trump just
Hang on, we have somebody on the phone. For the gentleman on the phone, can you go ahead and ask your question?
Yes, thank you. So you mentioned earlier that you've been preparing for pandemic for a long time, for decades. And looking at earlier pandemic response plans, the scenario is generally a pandemic influenza, it seems. Given that this novel coronavirus is very different from influenza, what are the challenges that you face in implementing a plan that was more or less, built around a disease that was known compared to this new disease that there's still a lot that's unknown?
Yeah, so when we look at our pandemic influenza plan, there are still parts of that plan that we can implement in response to this coronavirus. Because it is a respiratory disease and it is spread very much like influenza, some of the challenges with coronavirus is that we don't know if there's a season for it. So with influenza, we know that typically it's going to end sometime in the spring. That was not the case with H1N1. We still saw cases coming in over the summer and until we had a vaccine for it. But it was not in nearly the numbers that we were getting whenever it was in the winter time. So that is one of the challenges with this virus, is that we don't know if the weather if there's a season for this virus. If it's going to go away at the end of spring whenever the weather warms up and everybody's outside, or if it's something that's just going to continue until it's blown through and it's run its course, or there's a vaccine developed. So there are parts of our plan that we are able to implement, but there are definitely challenges with that because there's so many unknowns.
I would add to that, and then we'll get your question. We have, even with a new type of flu, the nation has a surveillance system for influenza-like illness. It is up and running from CDC. We have sentinel reporting sites right here in Missoula that inform that system. So they can see when things are when the activity's starting to rise. We don't have that for a brand new virus. So that goes back to what Cindy was saying. Not only do we not have that for a new virus, even though it's respiratory, we've had a delay in getting the testing available to inform what we call the epidemiology. What does it look like? What are the numbers? Who's getting it? What areas is it happening? Now that's starting to open up, but we've been operating, we and our entire healthcare system been operating without that information. So that's probably the biggest difficulty, as she mentioned.
Is there I'm just receiving a message from one of our watchers. Who would they call if they're in Ravalli County?
So if they're in Ravalli County and they just want general information about the virus, they can certainly also still call our 258 info number. If they need to, if they think that they're having symptoms or that they may have been exposed to the virus, we would encourage them to call their healthcare provider and let their healthcare provider give them specific guidance related to how that's going to happen in Ravalli County.
Thank you.
Mm-hmm.
There was a report, I believe it was in the New York Times, that said that health departments, county-level health departments throughout the country had been defunded in the last decade. Can you talk at all about whether or not that has been the case here in Montana, in Missoula specifically, and if there are concerns that the department doesn't have the resources it needs right now, or is that not an issue here?
I'm going to let Ellen Leahy take that. She's our health officer and the director of the department.
First of all, we get our funding from a lot of diverse sources. The Missoula City, but yes, we have been defunded. Maybe when you look at the net difference, you may not see defunding, but you won't see growth. So when we get money, it does tend to come for certain initiatives rather than necessarily this type of response. We do have one core piece of funding called the Public Health Emergency Preparation Grant, which is well funded for preparation, is not funded for response. Where we are fortunate in Missoula is
I'm sorry, I didn't catch the second half of that. Well funded for preparation?
It's well funded, yes. Public Health Emergency Preparation funds are well funded for preparation. They are not funded for response. So we don't have any level of money for the response we've rolled out so far and the staff we're trying to obtain. We do have in Missoula very good city and county support to our city county health department with local tax dollars. It's a little less than half our funds. That has not been reduced. So that is a benefit here in Missoula. We also save a reserve in the health department. The health board requires that I save a reserve for incidents such as this. This will, this is the rainy day we saved it for, we're spending it.
How much do you have?
Oh.
Is it enough? That's a good question.
It's enough that I don't have to think about, go ahead and hire, bring on. It's definitely enough for that. So we're not, we're pretty frugal, so we don't spend wildly, but I did have to tell the staff a couple weeks ago, start spending that money, and they said, you don't usually say that, and I said, that's correct. Start spending that money.
For Ellen or Cindy, I'm curious, I'm seeing some additional reports this weekend where they're talking about transmission, and there's some talk about asymptomatic and pre-symptomatic and those kinds of things. What should people take that with a grain of salt, or how should we as the public sort of evaluate those ideas?
So the research is still coming in on that. Right now, we do not have good guidance on whether or not there is asymptomatic spread. Most of what I've seen personally has been in the media and is not backed up by research. So that is the one thing that I would caution people is that, there are wild speculations in the media right now about how this is spread, what the mortality rate is going to be, who it's going to affect. And I would just caution people about believing everything that you're reading or hearing right now. We appreciate that here in Missoula, the media, all of you here in this room, do come to us and you ask us good questions, and you take what we say and you air that to the public. So we know that the public is getting good research-based data. And if we don't know, then we have no problem saying we don't know. But I would just caution the public to be aware of what you're reading and make sure that it's actually based on research and evidence and is not just wild speculations, because there's a lot of that out there right now.
So real quickly, count them down. What are the facts? How do we get it? How do we keep from getting it?
Yeah, so how we get it, it is spread by droplets. So very much like flu, when people are coughing or sneezing, the droplets go out into the air, they land on surfaces, they land on other people around you, which is why we are practicing social distancing. None of us are ill, but we need to get used to having that space between each other in case one of us were to become ill. We want people to stay home if you're sick, wash your hands, disinfect your surfaces. It's all the same things that we say every flu season. That's the best way to protect against droplet precautions. The evidence that is coming out, the data is showing that this is affecting older adults in much higher volumes than it is younger people. So anyone over the age of 65, particularly if you have chronic health conditions, should be taking extra precautions to protect themselves. Don't put yourself in public places with large volumes of people. Try to practice social distancing. Make sure that people that you are coming in contact with are not sick. It's all of those, and as for all the rest of us, people who have chronic conditions that are under the age of 65 are also at increased risk for developing bad outcomes from this, and so same thing applies. Wash your hands, cover your cough, don't put yourself in contact with people who are sick, practice good social distancing measures, but we are really seeing it affect that older population in much higher numbers and with much worse outcomes than like our children. Right now, the numbers that we're seeing for kids is that approximately 2% of the cases, both in Italy and in China, occurred in people under the age of 20. So that's only 2% of all of the known cases. So when we're looking like we're more worried about people that are living in long-term care facilities or receiving home health, that's why, is because 80% are in that age group that are over 60. Of the cases that they know coming out of Italy and coming out of China.
So how does having a large university in our community factor into that? That might not be the age group we're worried about, but they do have the social gatherings of that. So how does having a large university in our community affect our possibility of spreading this?
Yeah, so I don't want to speak for the university, but that did have a large role in their decision to move to more of an online learning platform, because we know that some of the lecture halls will have several hundred students in one room. A lot of people have asked us, why did we not recommend that they cancel the St. Patrick's Day parade? when we're looking at events that are outdoors, that are for short duration, that is a lot lower risk than if you have several hundred people all in the same room together. Indoor locations where, there's less ventilation, people are going to be in closer contact. So I do believe that that is what played into the university's decision to move to an online learning platform. There are still going to be other instances that, we can't just shut down the university completely, because we've got people who live there in the dorms that need to have a place to live. So I know that is kind of where what we're looking at is how do we balance what, our regular life and making sure people are taken care of, and still looking at those large gatherings where people might have the potential for spread. And so that's what Ellen was speaking to earlier about, if you're planning a large gathering that's going to be indoors and it's going to bring several hundred people, it might be a good idea to start thinking about canceling that, or figuring out if there's a way that you can broadcast that via Facebook Live or some other way of streaming, so that people are not all put into the same room.
Does the county have any resources or is making any plans to help parents with childcare needs in the event that schools start to close?
We do not have those resources. We are trying to work with our community partners to figure out what resources might be available. CDC guidance did come down Friday morning, as we said during our last press conference, about when school closure would be appropriate. And we do know that the schools are looking at that guidance, and they're also taking into consideration the things that Superintendent Watson was speaking to on Friday about, sometimes the school is the only place that those children are receiving meals, and that's where they receive their health care or their mental health care. And so they do have to balance all of those things, but we definitely what we don't want to happen is the schools to close and then parents have to send their children to a daycare where it's just defeating the purpose of closing the school in the first place, because then the kids are just congregating in a smaller space.
and MCPS spring break next week.
Mhm.
What about the private schools?
I don't know the schedule for all of the private schools as far as when their spring break is or when it is not, so I can't actually speak to that.
You both, somebody mentioned on Friday about employer participation. We haven't touched on that. Maybe just kind of kick in about, if you're out there, you're running a small or even a large business, what's kind of the best practices from that standpoint?
Yeah, so for businesses and employers, I know that there's a wide variety of businesses out there, and sometimes it's not feasible for people to be able to work from home. But it would be good to sit down and formulate a plan to say, okay, what are we going to do if we do have large numbers of employees who are out sick? Do we have a way to, pull another employer pool? If you have the ability to help your staff practice social distancing by working from home, especially if they're in those higher risk age groups, we are definitely encouraging that staff that employers really think about that, because those are some of the ways that we're going to slow the spread. And when I say slow the spread, I know Ellen has touched on this, and I believe I probably have too. We know that we're not going to stop this from coming to Missoula County. That's why it's called a pandemic. It is spreading, and the best thing that we can do is try to slow the spread so that we can flatten the curve, so that we're not overtaxing our healthcare system and overtaxing our economy in a time like this, and are able to respond appropriately.
I feel like we hear flatten the curve a lot, but what exactly does that mean in plain terms?
Yeah, so in plain terms, if I had a board, I would just draw you a picture.
We could draw a picture. Draw a picture.
Okay, Ellen's going to draw a picture for you. Basically, what we see is, with respiratory illness, we see big spikes and valleys if it's going unchecked. If we're not implementing social distancing measures, ways to slow the spread. So what we are trying to do is, instead of having these very large peaks and valleys, we're trying to flatten that curve so that our healthcare system and our economy doesn't take such a hit.
And it's going to spread it out over time. So you may get the same number of cases, but think of yourself as a hospital or a sick person needing intensive care or a respirator. Our hospitals can't do this. They're amazing. We are so lucky to be in Missoula. They can't do this. Can we do this? And then think of it in terms of voluntary disruption. If you're running a business, do you want to handle this, or do you want to do something here early? Do you want to, or, do you want to have all of your disruption at the end when you are actually closing your business by default because nobody can come in or nobody will come in? So that's what early response looks like. This is our goal.
Can you, what contingency plans, if any, does the City County Health Department have in the event that some employees start becoming sick, if nurses and paramedics start becoming sick?
Yeah, so we are working on that actively right now, trying to figure out what are our essential services that need to continue to happen in order to take care of our families in Missoula County, and what are some of our non-essential services where we may be able to say, okay, we're not going to do this with that staff, but we're going to cross-train them in other areas so that they might be able to pick up if we start having, people who are out sick, or if we need them for the response. So we are making those contingency plans at this point, and it basically is, how can we pull in our own employees and put them in other positions that they're not used to working in, both if we have people out and we need to replace those people, and if we just continue to need to ramp up our response.
We are currently, and before we had cases, before we had a press conference last week, we were being supported full-time by members of the Missoula Rural Fire Department and the Missoula City Fire Department, a lot of the folks that you see here from Emergency Management Services, a bunch of folks that are currently in the basement that you can't see. So we are having interagency support. Fire folks tend to have much more experience with the organizational aspects of incident command. We have some, theirs is better. They are taking some of those chief posts so that those of us that have a certain expertise in infectious disease control are being supported and can focus on that instead of just all the management of everything. So you can't see that, but they're there. And they're pulling them in. If we need somebody the next day, like we did this morning, I show up at our planning meeting and they're there. We have folks who have retired from incident command posts that are writing to us and asking to come in and help. So we're getting a tremendous amount of support and coming together in the community.
So basically, the rest is up to us, right, as the public, to do the right thing.
It is.
That is what we are asking the public to do, is to, the things that the actionable items that we really want the public to do is all of the things that we've been talking about. Social distancing. Don't put yourself in situations where you're going to be exposed to large numbers of people. Wash your hands, cover your cough, try not to touch your face. It's really hard. I have to sit with my hands crossed so that I don't touch my face.
I can't do it, but I'm working on it.
But those are the things that we're asking. And the biggest thing is, if you start to develop an illness, we are still seeing a lot of flu. We're still seeing a lot of colds. It's really important to keep your germs to yourself. If you're getting sick, stay home. Call your healthcare provider. Don't just go into the healthcare provider office if you're experiencing respiratory symptoms, because they have protocols in place to make sure that they're protecting the other people that are sitting in their waiting rooms. So those are the things that we are asking of the public at this point. Don't flood our 911 with questions. Call 258-INFO if you have questions. We need that 911 line to be reserved for our healthcare providers who need to get in touch with us.
Are people flooding 911?
We have started to see some people that are calling 911, and we're just trying to encourage that those people call the 258-INFO line, and if it would be more appropriate for that person to talk to their healthcare providers, that's what our people working that info line are telling them.
Just to clarify, if someone is feeling symptoms, their first call should be to their healthcare provider?
Yes. And there are other... Oh, sorry, I just want to clarify that. There are other systems in place. So the Providence Network does have a little chat bot. So if you are feeling like you are having some symptoms and you want to know if this is something you need to be worried about, you can get on that chat bot and it will help triage your symptoms. The Community Medical Center does have an Ask a Nurse line, and so there are other resources out there that you could use before calling your healthcare provider that will help you determine, do you really need to call your healthcare provider about this? And they just ask some basic screening questions and then help you to determine if that is the next step. Sorry, on the phone, you had a question?
Yes, thank you. What do you tell people? We sent out a newsletter last night, and I've gotten some responses. And one response came from an elderly woman who's in her 80s. And I've heard this a lot, that there are people who, in particular in some of those high-risk groups, who think that this is hysteria, that we're overreacting, that this is something that is, that this is overblown, that it's, media making much ado about nothing. What do you say as an expert in this field? What do you say to those folks who aren't taking this as seriously as they should be?
So we do want people to know that there is risk with this disease. We are seeing a higher mortality rate than what we see with the flu. This isn't a time to be hysterical about it. We are responding in the best way that we can, and our full response is just in order to flatten that curve and make sure that we're protecting our healthcare resources. But we do want people to take this seriously, especially if it is someone who is at risk for developing bad outcomes from contracting this disease. And we do understand that, there's a lot of conspiracy theories out there, and we're not going to support those conspiracy theories in any way. We don't want people to be hysterical, but we do want you to take it seriously and do what you can to try to protect yourself and to protect other members of our public that are in those vulnerable categories.
Are you working with Mountain Line in any way to ensure the buses are sanitized? And second, on Friday, I think I asked if you and the PAV are somehow working, or the YWCA. I talked to them on Friday briefly, and they're kind of still trying to work out what would happen if that virus showed up within the homeless population in those very tight quarters. Do you shut the shelter down? You said you don't like to isolate people together who are
right.
But what are you going to do in the event it shows up in that population?
So we are working with our homeless shelters and places like the YWCA or the Poverello and Mountain Line. We actually have all of our community partners sort of broken up into groups, and we've got people that are specifically assigned to make sure that they've got the appropriate guidance and try to answer the questions that they have. So we are actively working with them. The biggest concern that we have right now is what if we do get it in our homeless population, and we're working to try to identify if there is a resource somewhere that we can tap into in order to have a place to isolate those people. But this homelessness is an issue in our county, and it is something that we have not been able to solve in good times. And so we don't really have any reason to believe that we're going to be able to solve it in the midst of a pandemic either. But we are working to try and determine what steps we can take to protect as many people as we can.
So in general, I want to thank all the people that are already taking this seriously and taking preventive actions. And again, while there's things we don't know about this particular virus, we know a lot more than, we could have known 20 years ago had it happened. There's been a rapid response in terms of what the virus is, the genome, and the ability to make tests. We've talked about how we need more testing, but we need testing of the right people to inform our epidemiology, to inform our decisions, to understand local spread. But I just really, if we could close, I'd like to close by saying that a pandemic is not comprised of just the disease. It's people's response to it. And what we need to all do is gather some resolution and face it. So think of your neighbor.
Let me ask one more question. about the public schools? Who will make that decision as whether they stay open or closed?
So we work very closely with all of the public schools, not just MCPS public schools, but all of our school districts in the county. And when it comes time to make that decision, we will be making that decision together with them and with our other emergency response partners.